fellow Kenyans. Yesterday afternoon, I gave you an update of the status of coronavirus disease in Kenya, confirming that we had 4 cases as at yesterday. Today, we have received confirmation of another 3 cases of coronavirus. Following tests that were carried out by the National Influenza Center as well as KEMRI laboratories in the country. Therefore, we now have in the country 7 confirmed cases. It is very, very important to note that all these cases have been imported cases from outside the country. The first 2 cases related to these 3 that I've just mentioned are a couple that had traveled from Madrid, Spain on the 4th of March 2020 through Dubai, arriving in the country on the 5th of March. The third case among the 3 that I have now mentioned involves a Burundian national who had traveled from Dubai to Kenya, arriving on the 17th of March 2020, and this one was picked by our surveillance team with high temperature during routine screening at the Jomo Kenyatta International Airport. And that establishes, I think, what we have been saying all along. We are able to screen, and we are able to pick, and we are able to determine. So this one was a case in point, an establishment of that fact. So what we are doing now is that tracing of persons who may have come into contact with these patients is now ongoing. 18 cases are currently admitted at Bagathi Isolation Center. 7 others have been screened out and are negative. Samples from the remaining 11 suspected cases are currently being processed in our 2 designated laboratories. The 7 who tested negative are being processed for discharge to continue self-quarantine at home under close supervision of the Ministry of Health staff, collaborating with the country surveillance teams. I want at this juncture to make a special appeal to Kenyans who are traveling from outside the country. It is now clear that the threat that we face, first and foremost, is the threat from Kenyans who are coming from overseas, or Kenyans who have visited overseas countries. And that is why we had said that Kenyans who are coming in must self-quarantine. And we are happy to say that a lot of people have complied. But at this juncture, we also want to appeal to the general public that if you know that an individual who has agreed to self-quarantine and you can see them not self-quarantining, please report them to our toll-free number, 719, and let me remind such people that it is an offense punishable by a jail term for you to say that you are going to self-quarantine and you do not. And effective today, any Kenyan who is traveling from outside the country must sign a legal form at the airport, must sign a legal form to confirm that they are going to self-quarantine themselves, which gives us the instrument to actually jail you if you do not follow the procedure. If you do not, and the public pronounces you as such, and it is proved as such, we will then take you, self-quarantine you forcibly for 14 days, and then charge you in a court of law. On the issue of social distancing, we continue to emphasize that we do not wish to see any congregations anywhere. We do not want to see people congregating at any point. And this, again, will go a long way into stoppage of contacts that can create the spread of the disease. When we listened to the Chinese advice that they were giving us, they repeated over and over again the issue of washing your hands, the issue of social distancing as the key to why the Chinese infections are coming down at a very fast rate. And they are releasing people now, people who have been on self-quarantine, people who have been on government quarantine. You know, they are slowly beginning to release those people from those areas. And that is because of the discipline that they have exhibited. We continue to train the transport sector to keep sanitized vehicles, to keep sanitizing people, to keep out anybody who is exhibiting any symptoms of the disease. But you are also aware that people are staying home. And because people are staying at home, then the issue of transportation becomes less and less and less necessary. So, but we don't want to stop anybody because people have to go and get some food. People have to go and get provisions for their houses. So up to this time, we have not said that we are stopping completely. Of course, if the situation were to warrant it, then we would have to take that action. But for now, we are saying as long as we can establish that we can safely move people, then we will not stop it for now.